As lockdowns across Africa began, health officials sounded the alarm. Frightening, severe, catastrophic, words used to describe the continent's prospects in the pandemic fight. But that was then.
The countries in the Africa region are not where they had predicted that they would be by now. I think a lot of earlier predictions had painted a picture of by this time it would be quite overwhelming.
A group of leading African scientists have predicted a very different outcome. Even in the worst case scenario, their modelling suggests a smouldering outbreak in Africa, where many countries could avoid a deadly surge.
The deaths or the severity of the outbreak would also be a bit less severe than we've seen in other countries.
A key to their modelling work, including the socio-ecological factors that impact COVID-19 spread, like weather, population movement, urbanization. Two factors stand out: the relative youth of sub-Saharan Africa, 70% of people are under 30, and the lower burden of so-called diseases of lifestyle like diabetes, obesity and hypertension. Both, they believe, could lessen the severity of the disease. But even if countries avoid a surge, they believe that any spikes could overwhelm weaker health systems.
Those less severe outcomes need to be balanced against the capacity of the system to respond to those outcomes.
And despite the new predictions, the head of the Africa CDC says it's far too early to be complacent. He says just 5 countries on the continent represent more than half the confirmed cases, and overall, testing is still woefully inadequate.
I would characterize it as a delayed pandemic, and now we have to intensify our efforts, be bold and aggressive in putting in place public health measures.
Health measures like the army of health workers in South Africa tracing and testing for COVID. Here, unlike in many African countries, the cases are rising quickly, and the modelling of COVID-19's future spread will soon be tested. David McKenzie, CNN, Johannesburg.